Okay, those arising from bone, those arising from cartilage, those arising from fibrous tissues, and those tumors of uncertain origin. And been able to prepare slides based on those tumors arising from bone. As for today, which we will begin from the benign forms as the first one, and this is the osteoma. So osteoma is a benign bone-forming tumor that arises on the surface of the cortex. They usually develop on the surface of craniofacial skeleton and have a propensity to involve the bones of paranasal and the frontal sinus in orbit, where they are found in 1% to 3% of adult population. So these are tumors of adult, and maybe it's rarely found on children. Rarely, osteomas are found in vertebral column and appendicular skeleton, where they develop on the surface of long tubular bones. They affect more male frequently than females, and typically diagnosed during mid-adulthood, and at the same time maybe during adolescence. So this is just but the facts about the osteoma, which is a bone-forming tumor and arises from the surface of the cortex. And this tumor is commonly found on a craniofacial skeleton, and it could involve other bones and includes the paranasals. And we are told it rarely affects the vertebral column and the appendicular skeleton, but they may develop on the surface of long tubular bones, and these are the long bones of appendicular skeleton in particular. So about clinical features, we have large tumors may cause swelling, facial symmetry, and symptoms secondary to sinus obstruction. So sinus are the air-filled cavities, which are membrane bound and are found on the at the spaces found on the skull. When we shall be discussing about the cranial bones, we shall talk about the sinus as well. So tumors involving the spine can be complicated by spinal cord or nerve compression, and those developing in the extremities can present as a palpable mass that may be painful. So this is due to compression of adjacent neurovascular or the nerves next to the tumor. So all about the pathology, osteoma is usually solitary, which means a single lesion, but maybe multiple in minority of cases. Yeah, this is a kind of tumor which is most identified or recognized as a single lesion. And maybe in other cases it could be multiple, but it's a rare condition. So a diagnosis of osteoma in young patient or multiple osteomas should raise a suspicion of Gardner syndrome, and this includes autosomal dominant intestinal polyposis that progresses to adenocarcinoma, osteomas, dental anomalies, epidermal inclusion cysts, and soft tissue tumors. So these are Gardner syndrome. Could be may raise a suspicion, or maybe you could doubt about the Gardner syndrome of the same appearance to a patient who has osteoma. Cranial osteomas are usually asymptomatic and detected as an incidental radiographic finding. So these tumors are rarely found like any other tumor, and it could only be detected while doing other investigation on a radiographic image, and maybe that's where you could see that tumor. So the differential diagnosis, or the probability it could be this disease or the other. Otherwise, after investigation, so we have the well-differentiated intramedullary osteosarcoma and the osteoblastic metastasis. So they could present with the same pathology as osteomas, and that's why we have them as the differential diagnosis of osteoma. Under radiographic or radiological features, we have osteomas are usually round or void, uniformly radiodense, sharply demarcated from the surrounding soft tissue, and have a broad base of attachment to the cortical surface with which it merges. So these are the radiographic features which are expected to be seen from this kind of tumors, or this tumor known as the or the osteoid osteoma. So for the osteoid osteoma, as I said, it's found on the craniofacial skeleton of the skeletal of the skull. And here is it, which you can see as the radiodense kind of tumor appearing on the frontal bone. So is the osteoma rising on the surface and filling the frontal sinus on the lateral radiograph, which is this. Actually, it's very clear. This another form, maybe a rare, typical, found on the proximal aspect of fibula. So this is the bony tibia, this is the fibula. So osteoma rising on the surface of fibula. The tumor is void, well circumscribed, and radiodense. So it's clearly seen as a pathologic process on this bone. So this is the gross image of osteoma, sorry, of a long bone. The tumor is dense, turn white, and merges with underlying cortex. Yeah, the cortex of the bone is this, and the tumor is extending up there. Finally, we have the prognosis and the treatment. Osteoma are slow growing and indolent. Only symptomatic lesions can be treated, which consist of simple excision. And then we have malignant transformation of osteomas does not occur. So malignant are the forms of which the tumors advances to its greater intense.